West African nations are taking drastic measures to try and contain the worst Ebola outbreak in history. Liberia closed most of its borders. Sierra Leone is testing drivers at roadblocks. One local health leader there says deadly Ebola is worse than the nation's rebel war. The virus has killed nearly 700 in the region, including a Liberian man, Patrick SAWYER, who was ill on flights to Nigeria and died there, touching off a mad scramble to see who may have been exposed. SAWYER was about to visit his family in Minnesota.
I have 3 girls who will never get to know their father.
Family and church friends of 2 American aid workers who contracted the disease are praying for their recovery. Dr. Kent Brantley was treating Ebola patients in a hospital outside Liberia's capital. He's now in isolation.
He volunteered to give up his original assignment to head up the Ebola treatment facility at that hospital, so he knew the danger he was placing himself in.
Nancy Wright-Bull was supporting fellow missionaries in the same clinic, but the CDC says so far her case is milder. An Ebola infection starts with flu-like symptoms. It can cause bleeding from the eyes, mouth, and ears. It's spread through contact with bodily fluids. There is no cure or vaccine. The CDC says the mortality rate in this outbreak is 60%, but it's unlikely to reach the U.S. If it did,
we're pretty confident that the normal isolation protocols in U.S. or Western-style medicine would prevent transmission.
The CDC is deploying more teams to help in containment efforts. Cindy Sharp, Associated Press.